in Medicare anytime soon, well, here to talk with me about some of the pitfalls that you need to avoid is Dana Onspot from Sensible Money. Dana, welcome.
Thank you, Bob.
So, like many things in the world of personal finance, there are some pitfalls when people are enrolling in Medicare.
There are. You would think it would be easy. I'm 65, Medicare starts, my card shows up in the mail, voila. Unfortunately, there's all kinds of pitfalls that can come along. We are forgetful creatures by nature. We may not be aware of some of the rules. And in some cases, it can come back and cause some pretty significant penalties. One of the first things that comes to my mind is, in general, if you work for an employer that has over 20 employees, you don't have to enroll in Medicare if you're still working and turn 65. Now, we'll talk a little bit more about that. But if you work for an employer under 20 employees, you do. But here's the thing. Let's say you have a small employer and they just hired their 21st or 22nd employee. Who's to be sure they've revamped their coverage offering? They likely don't have a full and robust HR department to clarify some of these rules. So if you're in a smaller employer, always best to call the insurance company directly. Of course, you can talk to your benefits department, but you may want to take that extra step. Talk to the insurance company directly. Ask, is this coverage what's called creditable coverage? And if it is, then you wouldn't have to enroll in Medicare. There could still be some reasons to enroll in Medicare Part A, but you wouldn't have to enroll in Part B and D as long as it's creditable coverage and creditable drug coverage. And so that would save you those premiums. So Part B and D of Medicare have a premium attached to them, whereas Part A, if you've worked here in the US long enough, you qualify and it's free. So that's one of the first pitfalls that comes to mind. There's many, many more.
All right. So number 2 on the list.
Number 2. So let's say you leave work and you're, 64 and a half, just to kind of pull a number out of the air. You go on COBRA. That makes sense. It might be an economical way. Hopefully you compared COBRA costs to a healthcare.gov plan. And if you decided COBRA was the best coverage, you take it. Well, you may think, great, I can stay on COBRA until, 18 months is typically the time. But when you turn 65, COBRA becomes secondary to Medicare, and you are supposed to have enrolled in Medicare. And so people can get completely off guard. They just forget. They think their COBRA coverage is good. And so now they didn't enroll in Medicare. There may be an event that happens and they get could get hundreds of thousands of dollars of hospital bills, for example, that would normally be covered by Part A, but because they didn't enroll in Medicare, that wasn't in place. So there's a couple things to remember. If you get COBRA first and then become eligible for Medicare, then when you turn 65, COBRA will cease to become primary. So you have to enroll in Medicare. And if you enrolled in Part A and you have creditable coverage, and you have an employer that's over 20 employees, well, you can defer Part B and D, but then what happens if you go on COBRA, right? So you'll still need to enroll in Part B within 8 months of your employment ending. There's something called a special enrollment period there. And so if you don't enroll within that 8-month window of your employment ending, you will be subject to penalties when you do enroll. And so again, you also will need to see if you need to get Part D. So whether you take COBRA or not, you need to make sure the coverage you have is what's called creditable coverage. If it is, then you could delay Part D. And if not, there's a different special enrollment period to enroll in Part D. It's 63 days, not the same 8 months as Medicare Part B. And so again, if you miss that window of time and you were supposed to have gotten Part D drug coverage because the coverage you have is not creditable, then there could be penalties for enrolling late. So, they don't even make it the same special enrollment period. It can be very, very tricky.
All right, my head's spinning, but let me rewind for a second. I think you mentioned in the case that someone was 64 and a half and going on to COBRA or ACA. And oftentimes people, when they enroll in Medicare, they sometimes forget that they can enroll 3 months prior to their birthday month, during their birthday month, and 3 months after. Would you recommend that someone enroll 3 months prior to their birthday month if they're on COBRA or ACA? In the case that you mentioned, 64 and a half, they would be 64 and 9 months, let's say.
Absolutely. And so, as soon as you're eligible to enroll, if you know you need that Medicare to kick in at 65, then I would say 3 months before your birthday is perfect. It will then, coverage will begin the month of your birthday, unless you're born on the first of the month, and then it will kick in a month earlier. Again, one of those crazy rules. But you don't want to delay. Right now, we are at peak 65, more people turning 65 every day than ever in the history of our country. And so the system can get overwhelmed. So why wait till the last minute and risk any processing delays? Apply if you know you need it to begin when you're 65, apply 3 months early so that you can be confident and not have to worry about any of this.
Yeah. All right. Pitfall number 3.
So pitfall number 3 can happen when you are on an employer plan and maybe your spouse is also on that plan. And then your spouse turns 65. And maybe your employer plan isn't creditable coverage for the spouse. And so you may not have thought about it. They turn 65, just you're going about your business. No one really thinks about it. And so again, they were supposed to have enrolled in Medicare and they didn't. And so that could be a case where, again, your spouse is now uncovered, or again, you're on COBRA and your spouse might be on COBRA. Maybe COBRA becomes secondary to Medicare when they turn 65. So it could be the same scenario, except now instead of on your coverage, it's happening to your spouse because they turned 65 while on COBRA, didn't realize they were supposed to enroll in Medicare, and don't have the full coverage that they need.
Yeah. In the case of many large employers, we're in the middle of open enrollment season for many employees who get a chance to review their health insurance plans. They sometimes get documentation that says this is a creditable plan, but in the absence of getting that, you may have to take matters into your own hand and ask, as you said before, your HR department or the insurance company.
Yeah, if you're working for a company that has thousands of employees, likely they're going to have automated documentation through your benefits portal that you can access, a full-blown benefits department that you can clarify with. But if you're working for a smaller employer, we use this guideline. If you have over 20 employees, then you don't need to enroll in Medicare. Well, I wouldn't follow that carte blanche. Right? You would want to talk to the insurance company, get documentation that the coverage you have is creditable coverage and that you wouldn't need to enroll in Medicare. Now, you can still enroll in Medicare Part A since it's free. And in many cases, you would want to do so. The only real reason not to do so would be if you're contributing to a health savings account, an HSA. And so as soon as you're enrolled in any part of Medicare, then you can no longer make HSA contributions. So if you have creditable coverage, you're still working past 65, and you have an HSA, then maybe you delay all parts of Medicare. No HSA, then there's no reason not to just go ahead and enroll in Medicare Part A at 65. Then you at least don't have to worry about that piece later.
All right. Pitfall number 4. Is that what we're on now?
Pitfall number 4. So yes, you do have creditable coverage. Let's say you keep working, you're 68, maybe you're 70, maybe you're 72. You didn't want to retire, you're enjoying your work, but now retirement comes along. Well, there is a special enrollment period. You've had creditable coverage, so you won't have any penalties for late enrollment. But now, assuming you're going to get a traditional Medicare with a supplement plan, you'll need to roll Part A, Part B, Part D. And you have the special enrollment period, but there have been cases where the application processing is delayed. So I've heard they're not seeing the delays necessarily for those people turning 65 under the normal enrollment age, but for the legitimate late enrollees, they might wait till the month before their coverage is ending, or wait till after, right? Oh, my employment ended. Oh yeah, I need to go do this now. And now there can be processing delay, leaving you a gap of a month or two. And that's dangerous. An accident, a heart attack, a stroke, there could be all kinds of things that could come along during that gap. So if you know your employment coverage is ending, you're past 65, you've been on creditable coverage, best to apply early. It doesn't matter if you have a few months of overlap so that Medicare kicks in. Yes, if you're contributing to an HSA, you might have to stop those contributions during that overlap period, but that's going to be a far better outcome than experiencing some kind of delay and having a gap in coverage.
Yeah, and as you mentioned, a heart attack, you're in the hospital, it could be tens of thousands of dollars, perhaps, especially if you might need surgery, perhaps.
Absolutely.
Yeah. All right. Pitfall 5.
Pitfall 5 is, really, we've kind of talked about it, but many people don't realize there's different parts of Medicare. So there's Part A that's free, there's Part B, which is, a premium is paid, and then there's Part D, which is drug coverage. So when you look at Part D, you have to make sure your drug plan through your employer is creditable coverage also. And so that should be all in one package, but it's just some people don't realize, oh, I was supposed to enroll in Medicare. I did. I enrolled in Part A, done. Or I enrolled in Part A, B, and I need Part D. So just make sure there's three parts. If you are no longer working, you have the option of, instead of original Medicare plus the parts B and D, you have the option of choosing what's called a Medicare Advantage plan, which is a different kind of structure. Then you wouldn't have all of those different pieces because it's going to wrap those pieces all together for you. But for a lot of people, there's reasons to choose the traditional Medicare with a supplement. And so don't forget about Part D.
Yeah, we'll talk about that maybe in a future video that we do. In a way, you've already given a spoiler on number 6, on pitfall number 6, but feel free to elaborate on it.
Yeah, so pitfall number 6, I did mention, you're right, jumped the gun on that one, but it has to do with the overlap of HSA contributions and Medicare. So you cannot contribute to an HSA once you're enrolled in any part of Medicare. And so you need to be careful about that. Now, in some cases, people may have started Social Security, and then what happens is your Medicare will automatically enroll you at 65. Or people have seen that their spouse who isn't working maybe had claimed Social Security and their Medicare card just automatically showed up. And so they thought, oh, when I turn 65, there's nothing I need to do. My card will show up. That's a pitfall we didn't put on the list, but it's something to think about, that it's not automatic. So unless you're already enrolled in Social Security, Medicare is not automatic. And when you enroll in Medicare, that does not automatically enroll you in Social Security. They're two distinct decisions. So people need to know that. But in general, pitfall 6 was around HSA contributions. And so realizing if you are still working, you have creditable coverage, you're eligible to contribute to an HSA, that could be a reason to not enroll in any parts of Medicare. Otherwise, no HSA, you might as well enroll in Part A, even though you don't have to.
Yeah. My understanding, Dana, is that if you continue to contribute to your HSA after you're enrolled in Part A, is that there is a penalty assessed of some sort. I don't recall off the top of my head how much.
There is, and all of these things have penalties, and they're all different penalties. So I don't know them all off the top of my head either. But yes, there's a penalty if you don't enroll in Part B and you were supposed to, and it's a lifetime penalty. There's a penalty if you don't enroll in Part D and you were supposed to, and that can be a lifetime penalty in terms of increased cost. And then there is a penalty if you contribute to HSA and you were not supposed to. So
All
craziness.
Right. Well, I know there's probably more pitfalls than 7, but we're on 7. So
yeah, the 7th one, it really had to do with, let's say it's time. You've been through all of the decision tree that we talked about. You know you need to enroll in Medicare, in all parts of Medicare. Now you have a decision to make. Where are you going to use traditional Medicare with what's called a Medigap or Medicare supplement plan? Those terms are interchangeable. So if you hear Medigap or Medicare supplement, they mean the same thing. So are you going to have that kind of structure, or are you going to choose a Medicare Advantage plan? And I think we're going to do a whole separate video on that. But The main thing to remember is sometimes the Advantage plans are marketed as zero premium, and zero premium does not mean zero cost.
Yeah.
So there's pros and cons to the different structures. There's some additional risks sometimes that come along with the Advantage plan. So if you think about it, if it's zero premium, where's the give, right? The insurance company isn't covering us for free. We can be assured of that. So the government is paying them for these Advantage plan structures, but there's still a trade-off somewhere. So they're not going to cover all of the same things at all of the same levels as if you had a traditional Medicare structure with a supplement plan. So you have to know that there's trade-offs. If it's marketed as zero premium, you should be like, well, why? What could happen in a worst case scenario? What would be my maximum out-of-pocket costs? And you really need to be careful when you're making that decision. So that's pitfall number 7, is thinking, great, zero premium means free. I'm done. Of course, I'm going to choose that. And then ending up in a situation later where things you thought would be covered aren't.
Yeah. And this is an important topic, at least from my perspective. You've got over 30 million Medicare beneficiaries of the 60 million Medicare beneficiaries that are now enrolled in Medicare Advantage plans. So it's not an insignificant number of people who are choosing Medicare Advantage plans as their plan of choice.
Yeah, we're seeing those numbers growing, and you're also, unfortunately, starting to see a lot of media coverage on plans that were terminated. I was just talking with a client yesterday. They're in Texas, and she just enrolled in a Medicare Advantage plan like 3 months ago, not even 1 month ago. Her birthday was in October. And now just got the notice that Advantage plan is being terminated. And so she's like, wait a second, I just made this decision. Now the plan's being terminated. So she has to go back out during open enrollment and remake that decision.
Yeah, well, we make that maybe number 8 as our pitfall. So anything, anything that we missed, or anything that just bears reemphasizing?
It's tedious. As you said, some of the rules make your head spin. I don't remember the rules off the top of my head. I have to go look them up with each situation. We work with several Medicare experts, consultants in the field, to make sure that our clients have the guidance they need when they're navigating this decision. So I would just encourage people to talk to a lot of people, get help. Talk to various insurance agents. You don't have to make a decision with the first person that you talk to. Client we were talking to yesterday also has a consultant available they worked for a very large employer. And so they have a service that helps. But when we ask the question, do you feel like they really educated you on the pros and cons of traditional Medicare with a supplement versus an Advantage plan? They answered, no, we don't really feel like they educated us. And so just because you talk to the first person doesn't mean, you're getting quality pros and cons. You really want to take the time to understand this decision. It's got a material impact.
Yeah. And I often say that it's one of the worst things that we do to our older adults in this country is to make them make this decision, not only to enroll for the first time, but to enroll each and every year for the rest of their lives in a Medicare plan. And it comes at a time when maybe their cognitive abilities are declining. So it's somewhat cruel that we ask our folks to do this on their own without help.
It is. It's complicated. It's not easy to understand. It's complex. It's probably the same word as complicated, but it bears saying twice. Yeah, I agree 100%, Bob.
All right, Dana, it's always a pleasure having you share your knowledge and wisdom with our viewers and our readers. Thank you.
Thank you.